Welcome to Dietitian Academy, your shortcut to cracking dietitian exam. Hi everyone, I am Mohammad Shoaib, a certified dietitian with bachelor's and master's degree in nutrition and dietetics. I recently cracked AIIMS CRE Dietitian Exam with All India 4th rank in my first attempt, and now I am here to help you succeed in this RRB Dietitian Exam, which is going to be conducted in this month. On Dietitian Academy, I will be uploading 70 most predicted MCQs questions daily, focusing purely on exam relevant questions without going deep into the theory because the time is short. If you find this session helpful, I will also start topic-wise classes and provide notes for the future government dietitian exams. So subscribe now, stay consistent, and let's crack this exam together. Let's start our part 3 of our discussion series. Question number 1. Which hormone regulates cardiac rhythm and sleep-wake cycles? Melatonin, cortisol, insulin, thyroxine. The answer will be A. Melatonin. Melatonin secreted by the pineal gland is vital for regulating your internal clock. It signals the body to prepare for the sleep, and its secretion is influenced by the light exposure. This hormone helps maintain a regular sleep-wake cycle, making it essential for good quality sleep. If there is light, then the melatonin is not secreted. If the light is less, the melatonin is secreted. Question number 2. The primary site of nutrient absorption in the digestive system is stomach, jejunum, duodenum, ileum. The answer will be B. Jejunum. The jejunum is the middle section of the small intestine and is where most nutrient absorption occurs. Its highly folded surface increases the area for absorption, allowing for the effective uptake of vitamins, minerals, and macronutrients into the blood. Question number 3. Which cells in the pancreas produce glucagon? Alpha cells, beta cells, delta cells, acinar cells. The answer will be A. Alpha cells. Glucagon is secreted by the alpha cells in the pancreas. It plays a crucial role in raising blood sugar levels by stimulating the liver to convert stored glycogen into glucose. This mechanism is essential for maintaining energy balance, especially between the meals. Question number 4. The process of erythropoiesis occurs in the liver, spleen, bone marrow, kidneys. The answer will be bone marrow, C. Erythropoiesis is a process of producing red blood cells, and it occurs primarily in the bone marrow. The bone marrow's microenvironment supports the proliferation and differentiation of hematopoietic stem cells into red blood cells, which are essential for oxygen transfer throughout the body. Question number 5. Homeostasis in the human body is primarily maintained by which two systems? Nervous and endocrine system, circulatory and respiratory system, digestion and excretion system, muscular and skeletal system. The answer will be A. Nervous and endocrine system. Nervous system provides rapid short-term regulation through electric impulses, while the endocrine system uses hormones for longer-term regulation. Together, they ensure that the body responds to internal and external changes effectively, keeping various physiological parameters within a narrow range. Question number 6. A deficiency of vitamin B12 can lead to scurvy, pellagra, pernicious anemia, rickets. The answer will be C. Pernicious anemia. Vitamin B12 is essential for RBC production and neurological functions. A deficiency can lead to pernicious anemia, a condition where the body produces fewer abnormally large red blood cells, resulting in fatigue, neurological issues. It emphasizes the importance of adequate B12 intake in the diet. Question number 7. Which mineral is crucial for thyroid hormone synthesis? Iron, iodine, zinc, magnesium. The answer will be iodine. Iodine is a key component of thyroid hormones, which is T3 and T4. Without significant iodine, the thyroid cannot produce adequate hormones, potentially leading to conditions like hypothyroidism or goiter. This mineral is crucial for metabolic regulations and overall energy balance. Question number 8. Which vitamin enhances non-heme iron absorption? Vitamin A, vitamin C, vitamin D, vitamin E. The answer will be B. Vitamin C. Vitamin C acts as a reducing agent, converting iron into a form that is easier for the body to absorb. This is especially important for non-heme iron found in plant-based foods. making vitamin C a vital nutrient in preventing iron deficiency anemia. Question number 9. Omega-3 fatty acids are most abundant in olive oil, flax seeds, butter, coconut oil. The answer will be B. Flax seeds. Flax seeds are a rich source in plant-based omega-3 fatty acids, which are known for its anti-inflammatory properties. These fatty acids contribute to cardiovascular health and are important for brain function. They provide a vegetarian alternative to omega-3 typically found in fish. Question number 10. The primary role of dietary fiber is to provide energy, regulate bowel movements, build muscle, synthesis hormone. The answer will be B. Regulate bowel movements. Dietary fibers aids in digestion by adding bulk to the stool, which promotes regular bowel movements and helps prevent constipation. It also supports a healthy gut microbiome, which can have broader benefits for overall health and metabolic process. Question number 11. As per ICMR, the RDA for protein for sedentary adult female is 46 grams per day, 55 grams per day, 60 grams per day, 75 grams per day. The answer will be A. 46 grams per day. According to ICMR, the Indian Council of Medical Research recommends that the sedentary adult female consumes about 46 grams of protein daily. This level ensures that the body has enough amino acids for maintenance, repair, and metabolic functions without placing undue strain on metabolic processes. Question number 12. The acceptable macronutrient distribution range for carbohydrate is 10 to 35%, 45 to 65%, 20 to 35%, 15 to 25%. The answer will be B. 45 to 65%. AIIMS guidelines suggest that the 45 to 65% of daily energy intake should come from carbohydrate. This range supports optimal brain function and energy levels while providing essential nutrients found in carbohydrate-rich food like fruits, vegetables, and grains. Question number 13. Which dietary pattern is recommended for lactating women to meet increased energy needs? High protein, low fat diet, balanced with extra 550 kilocalorie per day, ketogenic diet, intermittent fasting. The answer will be B. Balanced with extra 550 kilocalories per day. Lactating women requires additional energy to support milk production. A balanced diet with an extra 550 kilocalorie per day helps meet these energy demands while ensuring that both the mother and the child receives essential nutrients. Question number 14. The term hidden hunger refers to overeating, micronutrient deficiencies, food allergies, obesity. The answer will be B. Micronutrient deficiencies. The term hidden hunger describes the situation where individuals may consume enough calories but lack sufficient nutrients and minerals. This deficiency can lead to long-term health issues even if the person appears to be well fed, highlighting the importance of nutrient-dense food. Question number 15. For a 30 years old male with BMI of 28, the diet plan should focus on weight management, weight loss, muscle gain, high calorie intake. The answer will be B. The BMI of 28 is considered as overweight. So the focus should be on weight loss through calorie control and balanced diet. A tailored plan can help reduce the risk of metabolic syndromes and other obesity related health issues over time. Question number 16. Which enzyme is responsible for hydrolyzing starch in maltose? Lipase, amylase, pepsin, lactase. The answer will be B. Amylase. Amylase is an enzyme that breaks down the complex carbohydrate like starch into maltose and other simple sugars. This process begins in mouth with saliva amylase and continues in the small intestine, ensuring that carbohydrates are available for energy production. Question number 17. The glycemic index of white bread is approximately 30, 55, 70, 85. The answer will be 70. White bread has a high glycemic index of around 70, meaning it can cause a rapid spike in blood sugar levels. This quick increase in blood sugar can be problematic for individuals with insulin sensitivity, making lower GI foods a better choice for sustainable energy. The 55 GI is considered as normal. Below this is low GI food. Above this is the high GI content food. Question number 18. Nutrigenomics studies the interaction between nutrient and gut microbiota, diet and gene expressions, food processing techniques, vitamins and enzymes. The answer will be B. Diet and gene expressions. Nutrigenomics explores both nutrient we consume can influence the expression of our gene. This emerging field helps explain why certain diet works better for some people, showing the way for personalized nutrition strategies based on genetic profile. Question number 19. Which fatty acid is essential in human nutrition? Linoleic acid, palmitic acid, oleic acid, stearic acid. The answer will be A. Linoleic acid. Linoleic acid is an essential omega-6 fatty acids that the body cannot synthesize on its own, meaning it must be obtained from diet. It plays a crucial role in cell membrane structure and it involves in various signaling pathways essential for health. Question number 20. The primary site of gluconeogenesis during fasting is the liver, kidney, muscle, brain. Answer will be A. Liver. During fasting, the liver is the central organ that carries out gluconeogenesis, converting non-carbohydrate substitutes into glucose. This process is vital for maintaining blood sugar levels when dietary carbohydrate intake is very low. Question number 21. Lycopene is a nutraceutical is predominantly found in tomatoes, spinach, carrots, blueberries. The answer will be A. Tomatoes. Tomatoes are the essential source of lycopene, an antioxidant linked to reduce the risk of certain chronic diseases. Lycopene's anti-inflammatory properties contribute to heart health and may help protect against some type of cancers. Question number 22. The beta-glucans are bioactive compounds associated with lower cholesterol, enhancing vision, bone health, immune suppression. The answer will be A. Lowering cholesterol. Beta-glucans found in foods like oats, barley have been shown to help lower blood cholesterols by binding to bile acids. This ability to modulate the immune system also contribute to overall cardiovascular health. Question number 23. Which nutraceutical is derived from turmeric? Curcumin, resveratrol, quercetin, capsicum. The answer will be A. Curcumin. Curcumin is the primary active compound in turmeric, known for its potential anti-inflammatory and antioxidant effects. Its potential health benefits have made it to a popular supplement for managing inflammation and supporting joint health. Question number 24. Probiotic primarily acts on which part of the body? Liver, gut microbiota, skin, lungs. The answer will be B. Gut microbiota. Probiotics consists of beneficial bacteria that helps balance the gut microbiota. They support digestion, enhancing immune function, and can even influence mood and overall well-being by maintaining a healthy internal environment. Question number 25. A patient with phenylketonuria (PKU) must avoid phenylalanine, tyrosine, tryptophan, leucine. The answer will be A. Phenylalanine. In PKU, the inability to properly metabolize phenylalanine leads to its toxic accumulation. Avoiding phenylalanine is critical in avoiding phenylalanine is crucial in preventing intellectual disabilities and neurological damage, making dietary management essential for individuals with PKU. Question number 26. The renal diet for chronic kidney disease restricts potassium and phosphorus, calcium and iron, sodium and vitamin C, fiber and fat. The answer will be A. Potassium and phosphorus. Patients with chronic kidney disease often have difficulty excreting potassium and phosphorus. Restricting these minerals helps prevent complications such as hyperkalemia, mineral imbalance, which are crucial for protecting kidney functions. Question number 23. Which diet is recommended for managing diverticulitis? High fiber, low residue diet, ketogenic, high protein. The answer will be B. Low residue. During acute diverticulitis, a low residue diet minimizes the volume of undigested material passing through the colon, reducing irritation and inflammation. This diet helps the bowel rest and heal more effectively. Diverticulitis is nothing but small pouches forming on the walls of the small intestines, so which causes irritation, inflammation, etc. By consuming low residue diet, there is less residue of food present in the colon, so the irritation will be reduced. Question number 28. For a patient with dysphagia, and the most appropriate food texture is pureed, chopped, regular, liquid. Answer will be pureed. Patients with dysphagia often have difficulty swallowing solid foods, so pureed textures are recommended. This consistency reduces the risk of choking and make it easier for the patient to safely swallow their meals. Question number 29. In hepatic encephalopathy, protein intake should be increased, restricted, unchanged, plant-based only? The answer will be D, plant-based only. In hepatic encephalopathy, it is associated with high levels of ammonia in the blood due to protein breakdown. Restricting protein, especially from animal sources, can help reduce ammonia production and alleviate the symptoms, while still ensuring adequate nutritional intake with careful planning. So we provide plant-based only. Question number 30. The gold standard for assessing total body water is bioelectrical impedance, dual energy X-ray absorptiometry, DEXA, isotope dilution, skin fold thickness. The answer will be C, isotope dilution. Isotope dilution involves introducing a tracer into the body and measuring its dilution, making it the most precise method to assess total body water. This technique is crucial for clinical assessment in patients with a fluid imbalance, whereas DEXA is used for body composition, and bioelectrical impedance is also used for body composition to find out the fat and muscle mass. Here, DEXA, they also find the bone density. Skin fold thickness is used for fat measurements. So the answer will be isotope dilution. Question number 31. A patient with severe burns requires increased intake of protein and calories, carbohydrate and fats, vitamin A and D, sodium and potassium. The answer will be A, protein and calories. Severe burns significantly increases the metabolic demand. Patients requires high amount of protein for tissue repair and calories to support the hypermetabolic state, which are essential for recovery and wound healing. Question number 32. Refeeding syndrome is characterized by hypophosphatemia, hyperkalemia, hyperglycemia, hypocalcemia. The answer will be A, hypophosphatemia. During refeeding syndrome, a rapid introduction of nutrient causes sudden shift in electrolytes, especially phosphate. Hypophosphatemia is dangerous because it can impair cellular energy production, underscoring the needs of nutritional rehabilitation. So whenever you find this question as refeeding syndrome, just remember you need to tick the hypophosphatemia. If there is no hypophosphatemia in the answer or the options, then you can go for hypomagnesemia or hypokalemia. So in these cases, the answer will be A. Question number 33. Which formula is used for parental nutrition? Ensure, Pediasure, TPN, Total Parental Nutrition, Boost. The answer will be C, Total Parental Nutrition. TPN provides nutrition intravenously for patients who cannot eat or absorb nutrients through gastrointestinal tract. It is carefully balanced formula for carbohydrate, protein, fats and vitamins and minerals designed to meet all the patient's nutritional needs. Question number 34. The most common critical indicator for malnutrition in children is stunting, wasting, underweight, mid-upper arm circumferences. The answer will be D, mid-upper arm circumferences. Mid-upper arm circumferences is a quick and reliable measure to assess nutritional status in children. It's directly correlated with the muscle mass and fat stores, making it a sensitive indicator for early detection of malnutrition. Question number 35. Which microorganism causes aflatoxins contamination in grains? Aspergillus flavus, Salmonella, Clostridium botulinum, E. coli. The answer is A, Aspergillus flavus. Aspergillus flavus is a fungus that produces aflatoxins, which are potent carcinogenics that can contaminate stored grains and nuts. This contamination poses serious health issues, highlighting the importance of proper storage and handling of food products. Question number 36. Pasteurization of milk aims to destroy all microorganisms, pathogenic bacteria, spores, virus. The answer will be B, pathogenic bacteria. Pasteurization is designed to reduce harmful bacteria in milk, ensuring its safety for consumption while maintaining most of its nutritional value. The process targets pathogens without completely sterilizing the milk, which helps preserve its flavor and quality. When you find the milk is pasteurized, they measure the phosphate content in the milk. If the phosphate content is present, then the milk is pasteurized. Question number 37. Fermentations of yogurt involves Lactobacillus bulgaris, Saccharomyces cerevisiae, Bacillus cereus, Pseudomonas aeruginosa. The answer will be A, Lactobacillus bulgarius. So Lactobacillus bulgarus along with Streptococcus thermophilus ferments the lactose in milk to produce lactic acid. This acidification not only thickens the yogurt but also enhances its flavors and preserves it by lowering the pH. Question number 38. Botulism is caused by ingestion of preformed toxins in canned foods, raw poultry, contaminated water, undercooked beef. The answer will be A. Preformed toxins in canned foods. Botulism results from ingesting preformed botulism toxin, often found in improperly canned or preserved foods. This toxin interferes with the nerve functions, making promote medical treatment essential to prevent severe complications. Question number 39. HACCP principles are used to ensure food safety, enhance food flavors, reduce food cost, increase shelf life. The answer will be A. Ensures food safety. HACCP is called Hazard Analysis and Critical Control Point. Is a systematic approach to identify and controlling potential hazards in food production. Its implementation is crucial for minimizing risk and ensuring that food products are safe for consumption. Question number 40. The Mediterranean diet is effective in preventing cardiovascular diseases, osteoporosis, migraine, asthma. The answer will be A. Cardiovascular diseases. In Mediterranean diet, rich in fruits, vegetables, whole grains, olive oil, and lean protein has been linked to lower risk of cardiovascular diseases. It emphasizes on healthy fats and antioxidant helps reduce inflammation and support heart health over time. Question number 41. A low food map diet is recommended for irritable bowel syndrome, IBS, type 2 diabetes, hypertension, celiac disease. The answer will be A. Irritable bowel syndrome. Low food map diet reduces certain fermented carbohydrate that can trigger IBS symptoms by minimizing bloating and discomfort. This diet helps manage symptoms and improve quality of life for individuals with IBS. FoodMap is called fermented oligodimmonosaccharides. Question number 42. Which dietary component exacerbates gout? Purines, oxalates, lactose, gluten. The answer will be A. High purine foods increases uric acid production in the body. Excess uric acid can lead to formation of crystals in joints, causing painful gout attack. This makes dietary control of purine intake important for individuals prone to gout. Question number 43. For patients with cholelithiasis, limit intake of fatty foods, fiber, protein, carbohydrates. The answer will be A. Fatty foods. Cholelithiasis or gallstone disease, also called as gallstone disease, is often exacerbated by high fat intake. Reducing fatty food helps minimize gallbladder stimulation and can alleviate symptoms associated with the gallstones. Question number 44. In cancer cachexia, nutritional support focuses on high protein, high calorie diet, low fat diet, fluid restrictions, antioxidant supplements. The answer will be A. High protein, high calorie diet. Cancer cachexia involves severe muscle wasting and weight loss. A high protein, high calorie diet is crucial to help preserve muscle mass, boost energy levels, and support overall body functions during cancer treatment. Question number 45. The Krebs cycles occurs in cytoplasm, mitochondria, nucleus, endoplasmic reticulum. The answer will be B. Mitochondria. The Krebs cycle, also known as citric acid cycle, takes place in mitochondria. This series of chemical reaction is fundamental to energy production, converting nutrients into usable energy for cellular function. Question number 46. Conversion of pyruvate to acetyl-CoA requires thymine, riboflavin, niacin, vitamin B12. The answer will be A. Thymine. Thymine serves as an essential coenzyme in the pyruvate dehydrogenase complex, facilitating the conversion of pyruvate into acetyl-CoA. This step is critical in linking glycolysis to Krebs cycle. underscoring the vitamin importance in energy metabolism. Question number 47. Which lipoprotein transports cholesterol to liver? LDL, HDL, VLDL, chylomicrons. The answer will be B. HDL. High density lipoprotein is known as good cholesterol because it transports excess cholesterol from tissues back to the liver for excretion. This reserves cholesterol transport mechanism is protective against atherosclerosis and heart disease. Question number 48. Urea is synthesized in the liver, kidney, pancreas, small intestine. Answer will be A. Liver. Liver plays a key role in urea cycle, converting toxic ammonia into urea for safe excretion by the kidneys. This process is critical for maintaining the balance of nitrogen in the body and preventing toxic accumulation. Question number 49. Ketone bodies are produced during breakdown of carbohydrate, proteins, fats and nucleic acids. The answer will be C. Fat. During period of low carbohydrates intake or fasting, the body breaks down fats to produce ketones. This serves as an alternative source of energy, especially for the brain. Or vital adaptation during prolonged periods of energy restriction. Question number 50. A double-blinded study design ensures neither participants or researchers know the group assessment. Only participants know the group assessment. Data is collected twice. Statistically, analysis is unbiased. The answer will be A. Neither the participant nor the researchers knows the group assessment. Double-blinded study design helps to reduce bias by ensuring neither the subjects nor the investigators know which group is receiving the treatment. This methodology is critical for ensuring the reliability and validity of the clinical research findings. Question number 51. A p-value less than 0.05 indicates statistical significance, clinical relevance, correlation coefficient, standard deviation. The answer will be A. Statistical significance. A p-value less than 0.05 is considered as statistically significant that the observed results are unlikely due to the chance, supporting the statistical significance of findings. However, it's important to interpret p-values alongside other data and study design factors. Question number 52. Which study design established causality? Cohort study, randomized control trial, RCT, cross-sectional study, case control study. The answer will be B. Randomized control trial. Randomized control trial are considered as gold standard for the establishing causality because randomization minimizes the bias and helps ensure that any difference in outcomes are directly attributed to the intervention. Question number 53. The mean of a data set is 50 with the standard deviation of 5. What percentage of data lies within the 45 to 55 range? 34%, 68%, 95%, 99.7%. The answer will be B, 68%. In normal distribution, the data lies around 68% within one standard deviation of mean. This is a fundamental concept in statistics that helps in understanding data variability and distribution. Question number 54. For a type 1 diabetic patient, carbohydrate counting is used to adjust insulin doses, reduce caloric intake, limit protein intake, prevent hypoglycemia. The answer will be A. Adjust insulin doses. Carbohydrate counting is a critical tool for managing type 1 diabetes by accurately estimating carbohydrate intake. Patients can adjust their insulin dose accordingly to maintain stable blood sugar levels and prevent both hyperglycemia and hypoglycemia. Question number 55. The primary goal in managing nephrotic syndrome is to restrict protein intake, reduce edema, increase sodium intake, limit fluid intake. The answer will be B. Reduce edema. In nephrotic syndrome, there is a significant loss of protein by urine. It causes the significant fluid retention and edema. The primary treatment approach involves reducing fluid overload and controlling sodium intake, which helps alleviate the swellings and support kidney functions. Nephrotic syndrome is loss of protein in urine. Question number 56. Which diet is contraindicated in pancreatitis? Low fat, high fiber, high protein, high carbohydrate. Here the answer will be B. High fiber diet. During acute pancreatitis, a high fiber diet may increase the overload of digestive system, potentially exacerbating symptoms A low-fat diet, low-residue diet is typically recommended to allow pancreas to rest and recover, but in the option there is not mentioned any high-fat diet. So the answer will be high fiber according to these options. Question number 57. In anorexia nervosa, the first step in nutritional rehabilitation is gradual calorie increase, immediate high calorie feeding, vitamin supplements, fluid restrictions. The answer will be A, gradual calorie increases. In nutritional rehabilitations, in anorexia nervosa must be approached cautiously. A gradual increase in calories help prevent refeeding syndromes while steadily restoring nutritional balance and improving overall health. Question number 58. A patient with dumping syndrome should avoid simple sugars, complex carbohydrates, proteins and fats. The answer will be A, simple sugars. In dumping syndrome occurs when the food, particularly simple sugars, moves too quickly from stomach to small intestine. These rapid transits can cause a sudden release of insulin and other symptoms. Avoiding simple sugars can help manage the symptoms. Question number 59. Insulin resistance is hallmark of metabolic syndrome, hypothyroidism, Addison's disease, Cushing syndrome. The answer will be A, metabolic syndrome. Insulin resistance is a core feature of metabolic syndrome, which includes a cluster of conditions like high blood pressure, high BP, high blood sugars, and abnormal cholesterol levels. This resistance increases the risk of developing type 2 diabetes and cardiovascular diseases. Question number 60. In marasmus, the primary metabolic adaptation is reduced basal metabolic rate (BMR), increased gluconeogenesis, muscle protein breakdown, fat storage. The answer will be A, reduced basal metabolic rate (BMR). In marasmus, a form of severe malnutrition leads to body conserve energy by lowering the basal metabolic rate. This adaptation helps the body survive prolonged periods of inadequate calorie intake, although it also results in significant weight loss and muscle wasting. Question number 61. Which electrolyte imbalance is common in uncontrolled diabetic mellitus? Hyperkalemia, hypokalemia, hypernatremia, hypocalcemia. The answer will be hyperkalemia. In conditions like diabetic ketoacidosis, DKA, diabetic ketoacidosis, insulin deficiency causes potassium to move out of the cell, leading to elevated blood levels. These apparent hyperkalemia dispute total body potassium depletion, requires careful modification in diabetic patients. Question number 62. Chronic alcohol consumption impairs absorption of thiamine, vitamin C, iron, calcium. The answer will be A, thiamine. Chronic alcohol uses interface with thiamine absorption and metabolism, often leading to thiamine deficiency. This deficiency can cause severe neurological issues, highlighting the need of proper nutrition in individuals who consume alcohol regularly. Providing them a thiamine supplement will be beneficial. Question number 63. In cystic fibrosis, malabsorption is due to pancreatic insufficiency, liver dysfunction, gastric atrophy, intestinal parasites. Pancreatic insufficiency. In cystic fibrosis, thick mucus will be formed. This thick mucus obstructs the pancreatic duct, resulting in insufficient release of digestive enzymes. This pancreatic insufficiency leads to malabsorption of nutrients, requiring specialized nutrition support and enzyme supplements. Question number 64. Poshan Abhiyan aims to reduce malnutrition, tuberculosis, diabetes, hypertension. The answer will be A, malnutrition. Poshan Abhiyan is a government initiative in India focused on reducing malnutrition by promoting nutritional awareness, improving dietary practices, and ensuring food security for all segments of the population. Question number 65. The midday meal scheme in India targets school children, pregnant women, elderly, lactating mothers. The answer will be A, school children. In midday meal scheme is designed to enhance the nutritional status of school-going children by providing a balanced meal during school hours. This initiative not only supports health but also improves school attendance and academic performance. The WHO defines obesity as BMI greater than 25, 30, 35, 40. The answer will be B, 30. According to WHO, a body mass index, a BMI of more than 30 is considered as obese. This threshold helps in diagnosing obesity and implementing appropriate health interventions to reduce associated risk. Question number 37. Fortification of salt with iodine prevents goiter, anemia, rickets, beriberi. The answer will be A, goiter. Iodine is essential for thyroid hormones like T3, T4, TSH. Fortifying salts with iodine is a public health strategy that helps prevent iodine deficiency disorders such as goiter, which is characterized by an enlarged thyroid hormone. In this, thyroid hormone is enlarged. Thyroid gland is swollen. Question number 68. The recommended age for initiating complementary feeding is 4 to 6 months, 6 to 8 months, 8 to 10 months, 10 to 12 months. The answer will be B, 6 to 8 months. Health authorities generally recommend beginning complementary feeding around 6 to 8 months of the age. At this stage, the infants are ready to try solid foods while continuing to receive the benefits of breast milk or formula. Question number 69. A common nutritional deficiencies in the elderly is vitamin D, vitamin C, vitamin K, vitamin B. The answer will be A, vitamin D. Vitamin D deficiency is widespread among elderly due to reduced skin synthesis, lower dietary intake and limited sun exposure. Adequate vitamin D levels are essential for bone health and immune function, making supplementation and diet important consideration. Question number 70. Cow's milk is not recommended before 12 months due to the risk of iron deficiency anemia, obesity, allergies, hypernatremia. The answer will be A, iron deficiency anemia. Introducing cow's milk too early can interfere with iron absorption and may cause microscopic gastrointestinal bleeding, leading to iron deficiency anemia. This is why health organizations advise waiting until after 12 months before introducing cow's milk as a main drink. So that's all for today. That wraps up our key questions and concepts in the physiology, nutrition and clinical nutrition. I hope this expanded explanation helps clarify this topic even further and prepare you for your next exam or clinical practices. If you found this video helpful, please give it a thumbs up, share it with your friends and don't forget to subscribe for more educational content. Leave your questions and comments down below and I will see you in the next video. Until then, take care. Bye.